to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Gene Bergeron, a nurse practitioner at Terrebonne General Health System. Today, we're going to be talking about sepsis awareness and how to take action before becoming septic. Welcome to the show, Gene.
Hi.
Well, thanks for being with us today.
You're welcome.
Let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
I'm one of the nurse practitioners for a hospital medicine team. My role is to admit patients, do consults, and continue on the care of the patients in the hospital. And I also work in the emergency room part-time and in our multidisciplinary clinic.
Okay, so can you tell us what is sepsis?
Sepsis is an overwhelming response of the body, typically could be bacterial, fungal, viral. Most of the time it's bacteria enters the bloodstream, and then your body's overwhelming response. It can affect your heart, your lungs, your brain, your kidneys, your liver.
Okay, and what causes sepsis?
Sepsis is typically, like I said, due to bacterial, viral, or fungal, and it's definitely a medical emergency that needs to be dealt with in a timely manner.
Okay, and who can get sepsis?
Really anyone. There are risk factors for sepsis. Patients with chronic medical problems, whether it be kidney problems, lung problems, liver problems, transplant patients, patients that are bedbound, patients with recent surgical interventions, patients with chronic urinary problems, whether they have a Foley catheter, recent kidney stone stents, things like that.
Okay, and what are the symptoms that people can look for of sepsis?
The symptoms sometimes can be misleading, but generally patients will be running a fever, or they'll be hypothermic, meaning your body temperature is lower than normal, fast heart rate, tachycardia, trouble breathing, altered mental status.
Okay, so
Right.
What's the importance of recognizing and treating the symptoms early?
It is deadly, and the main thing is timely detection and timely treatment is the most important thing.
Okay, and can you tell us about what Terrebonne General offers for treating these types of patients?
We have a multidisciplinary team that includes physicians, nurse practitioners, nurse managers from each floor, the pharmacy department, the lab personnel, really a complete hospital-wide program.
Okay.
And we meet once a month to discuss sepsis treatment, to come up with guidelines and different things. We educate the staff.
Okay, I know you're a part of that program.
Right, I am.
And there's protocols that you have in place?
Right, we actually have a sepsis protocol that is initiated on admission for all patients, and our computer program actually has the sepsis criteria that's in it. So even if a nurse is checking in a patient and there's certain criteria, tachycardia, fast heart rate, fever, white blood cell count, it'll actually pop up on the screen to notify the medical provider that the patient may be septic.
Oh, that's wonderful. What is the treatment for sepsis?
First of all, the medical provider will identify a patient at risk for sepsis, and cascade of testing, including blood work, blood cultures, x-rays, CAT scans, that type of thing, to identify where the infection may be coming from. And then once it's identified, patients usually require hospitalization, some intensive care units, IV fluids, antibiotics, different types of medicines to help with the overwhelming inflammation, steroids. Most of the time, patients will require prolonged hospital stays.
So it is treatable?
Absolutely.
So 87% of cases start in the community.
Right.
Any tips on how to prevent this?
The most important thing is if you're ill, and I mean if you have any risk factors that we talked about, is to seek medical attention from your primary care provider or the emergency room. And in a timely manner is the most important thing.
Okay. So what are 3 things that you want people to know about sepsis?
Sepsis can happen to anyone. Obviously, advanced stage is one of the risk factors, but even infants can get sepsis. So really, age is a factor, but it's not the biggest factor. And the most important thing is, like I said, timely manner. If you're sick, seek treatment from a qualified medical provider.
Okay. Well, thank you. Well, thanks so much for your time today. We appreciate you doing all this, serving on the committee and bringing awareness this month during September.
Absolutely. Thank you.
For more information about sepsis awareness, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next time.